Hi everyone, my name is Leah Wilson. I'm the Director of Kinship here at Arrow Child and Family Ministries, and I'm just here to tell you a little bit about my agency and hoping to get you a better idea of if this could be a good fit for you. So let's start with talking a little bit about how our agency was founded. Our agency was founded by a man who grew up in the foster care system. His start was rough, kind of to say the least, but he ended up being adopted by his forever family, and he founded Arrow in an effort to try and recreate that experience for other children that have gone through the same experiences. We try to fulfill our founder's mission of helping children and strengthening families in everything that we do. And we firmly believe that kinship is a great way to do that, to not only help your families, but also to make sure that those kids are getting the best care that they can with people that know and love them. Next, I just want to talk to you about all of the areas that we serve. So you can see in the map behind me that we have offices all throughout Texas, all the way from Amarillo down to McAllen. So if you are in any of the areas that you can see here on the map, we do have an office that serves there. I think it's easier to tell people that kind of the only areas that we don't serve is more of our El Paso area and our Corpus Christi, but anywhere else in between, we are able to serve you. So a few reasons I just want to share of why to partner with Arrow is, first of all, we really try to focus on good customer service. You'll have multiple staff that are working with you to help you alongside this process to make it so that it's not so overwhelming, as we know it's already a lot of paperwork, a lot of training, but that is one of our key focuses. We also try to make all of our training cater to our kinship families, but also to provide you with information about how to care for the kids that are in your home that have gone through trauma. We also have our unique programs offered for our kinship families. We have staff that are specifically designated to just work with kinship homes. We also have a couple of other programs that will partner alongside you. Our first is our behavioral health services program that will provide in-home skills training to the kids that are in your home to help them with anger management, frustration tolerance, learning coping skills. And if you're caring for a child that has more medical needs, we have Arrow Health Solutions that will also help you to get all the equipment and the services that you need for their medical needs. Our founder's goal was to help kids and strengthen families, and kinship care is really a way that we believe that we can do that. Kinship has shown to really benefit children. They tend to have less moves, less behavioral problems, and less mental health concerns. And so we really do want to support you and to continue to care for kids in the homes that they are already in, where they already feel safe and loved. So you will be assigned one of our family engagement specialists that will specifically work with you as a kinship home to help you get through this process. We understand that you are stepping into this in a different place than, say, a traditional home that has decided to come in at a time that worked best in their lives and has prayed about it and was able to kind of make that decision. I recognize, being a kinship family myself, that often this decision was made for you maybe overnight. And so we want to support you in all that you're going through to help you get through this process. We cover two big programs here at Arrow through our Foster and Adopt program. Our first is foster care. So if you are serving children in your home that maybe rights have not been terminated yet, they may be in the process of getting reunified back with their birth parents, or you might be interested in taking guardianship, or PMC, a permanent managing conservator of these kids. And so that is a great avenue for you. One thing that we want all of our families that are going through the PMC route to get is permanency care assistance. And the way that you can do that is by fostering and having those children in your home as foster youth for 6 months. So we will work with you to be able to understand that process so that you can be leaving our agency with long-term benefits. And we also have our adoption program, which I'm going to talk a little bit more about in our next slide. We have a special program called Kinship Straight Adopt. We started this program specifically for kinship homes where they are coming through with us and the rights are already terminated for birth parents, and the only reason that you're here is to be able to adopt and be able to move on to a normalcy with the children that are in your home. And so the benefit of this program is that it's less requirements than it is for fostering and can help you get to that end journey a little bit quicker. There's less training, less paperwork, But just to note, children will not be placed in foster care if they go this program, and we will also help you to understand whether or not you'll qualify for adoption subsidy. One other program that I do want to cover and talk about briefly is our treatment foster care program. Our treatment foster care program is designed to help families that are caring for kids that have a higher level of mental health and behavioral needs. Oftentimes these are children that have maybe been in psychiatric facilities or residential treatment centers. They have a higher level of acuity, and we just want to make sure that those kids are well supported and that you as the caregivers are being given the skills and the tools that you need to be able to keep them in a home environment. And so this is a great program to be able to give you some extra supports in your home for a limited amount of time. This program is about 9 months to a year, and after that year, that doesn't mean that the children leave your home. It just means that we start to try and taper down some of our services. You'll have a therapist that is assigned to you. You'll also work with our behavioral health services program, and you'll also get a higher reimbursement rate because we know there are so many more appointments and so many more things that are required of you as a caregiver when you're caring for a child that has a higher level of need. Before I go to my last slide and talk about how you can fill out an application with us if you are interested, one other thing I just want to highlight is that Arrow is able to care for children with all levels of care. We care for children with medical needs. We can care for children that have higher mental or behavioral health or require therapeutic services. We also work with children who have intellectual delays and autism spectrum disorder. So we are able to care for children who are at any kind of level and with any family that is caring for those children as well. Hopefully you were able to get some more information about our agency, and if you're interested in learning more, please email me at my email address that is on the screen, and you can email me any questions that you may have, and I can get you connected with one of our recruiters that will help you fill out an application. With that application, you'll submit copies of your driver's license and your social security numbers, and we will get you connected to the people that can help you with the rest of your journey. Thank you for your time.